Welcome back to Quickies and Queefs. I'm Laurel, and today I want to talk about something a little more serious. We're talking about panic attacks and panic attacks in the bedroom brought on from sexual trauma and how to handle them in the moment and going forward. My partner and I were having sex, and it triggered a memory of some past sexual trauma that I have that happened when I was 17. I'm 23 now, so it's been a while, but I was kind of numb to it until that moment. Sorry, just catching my breath. And then it presented, and I had been thinking that it didn't really affect me that much, that maybe I'd processed it or whatever, but it really made me realize how much it still affected me when I just he was on top, and I started hyperventilating, and I just left my body, and I closed my eyes, and I was having a really hard time, and he handled it really well. And what he did is advice that I'm just going to pass on to you, because like whether your partner has past sexual trauma or you do, this is a really good tip, and it really worked in the moment. Obviously you need to do further work, which we'll talk about in a second, but what he did was he just kept saying, baby, it's okay, you're safe. And he really encouraged me to open my eyes and look at him, because that brought me back into the room and out of the memory. And he just kept saying, you're safe, you're safe, you're safe. And it passed pretty quickly, just looking into his eyes and knowing that it was him, and that I was safe. So moving on from that, I think that it's actually a really good thing if it comes up, because as maybe trauma kind of comes up and in different ways in your life. Like you manifest situations that will help you deal with it if you don't. So it's not like you can just push something away and it will never come back. But if it is coming up for you, then that means that you're in a place to start dealing with it and start healing from that pain. It's taken me years. I really was numb to it, and I think if you are, then maybe that's where you need to be right now. But I would start working on it, and I highly recommend seeing a therapist. There are different kinds of therapists. Like, I mean, the one I'm talking about is like psychotherapy. You can do body work, where they help you to like re-experience your trauma in a safe place. Or something that I'm wanting to look into actually is kinesiology, because it's like the kinesiologist speaks to your body, and yeah, I don't know that much about it, but it feels like something that might be good for me and my healing and my journey. So if I do, I'll let you know. Otherwise, there's so much out there, but just do what feels right for you, because that will be what your body's wanting. And just remember that your body really stores it, and it can come out in so many different ways, and it can really damage your self-worth and your beliefs about the world and trust, and it's multifaceted. And if you are dealing with sexual trauma, I am so sorry this happened to you, and just be kind to yourself. It gets easier, it gets better. Okay, all my love, bye.